Hey, good day, everyone. Thank you for tuning in to another LMDental presentation. My name is Anssi DuMontier, and I represent LMDental here in North America. Today, we are going to go over some restorative instruments, um, selected instruments, not including the LM Arte. Um, will be about 20 minutes, so not too long. And after that, there will be opportunity for questions. And if you have any comments or if you would like to share story or experience you using these instruments or representing these instruments, depending, please would love to hear from you. Okay, without further ado, let's get going. So as most of you already know, LMDental is deeply rooted in the Nordic countries, in Scandinavia. All of LM products are manufactured in Finland. However, despite that one solid location there up in the north, LM instruments are not only used but trusted by a variety of dental professionals all over the world. Um, Most people know LM to be a little different compared to other good instruments by the ergonomics, how they feel, how they look. But what you might not know is one of the biggest differences LMDental compared to other good manufacturers is a simple fact that we use a state-of-the-art robotic manufacturing in our production in Finland. So many practitioners don't often call instruments tools. However, categorically, dental hand instruments are precision tools. And in today's world, the best way to manufacture accurate and precise precision tools is through robotics and manufacturing automation. So that's a huge difference kind of behind the scene compared to others. Now, let's get to the nitty-gritty. First instrument line we're talking is the LM Dark Diamond. And here our slogan is pleasant and precise sculpting of composites. And many of my friends, both practitioners and on the trade side here in Americas, have told me, honestly, this must be a Finland thing. Dentistry is not always that pleasant. I get it. However, the idea here is that the procedure is made more pleasant to the practitioner with this technology used on these instruments. And here is why. So the dark diamonds, they have a DLC, it's a diamond-like carbon micromembrane coating that is applied on these tips. It's a super hard coating. It's also very, very smooth. It simply reduces the surface area of these instruments, resulting lower surface energy and non-stick environment. So the resin material does not stick on these tips the way it does on most other tips and materials. Also, this hard surface, for practical reason, it cleans up very quick and easy. It's also resistant for common wear and tear and scratches from daily use and reprocessing cycles. It also provides a very nice and accurate contrast because of its color and shade compared to resin materials and or tooth surface. And today we often work under good magnification, lights, often very effective lights, and many traditional composite instruments, whether gold color or a metal silver color, can be very shiny and very reflective of light. The LM Dark Diamond coating also effectively reduces that light reflection when we work with them. Last but not least, the dark diamonds are offered in the ErgoSense handle. So this is the medical grade larger diameter So what that does for you, it allows very accurate control, manipulation of the instrument when placing composites, and very high tactile sensitivity. You probably see the colors there, or you probably know already that LM has colored handles. So this is also a very nice detail when it comes to composite work. So you can focus on your patient, and already in a corner of your eye, you can tell which instrument you want and need next, because you can identify that by the color. If you work four-handed, very quick and easy to tell assistant blue one, red one, yellow one, create a nice smooth workflow instead of wasting time identifying instruments by the small tips. So here is the lineup of the dark diamonds. On the left-hand side is what we call the Burnisher. I would label that as a packer, condenser packer. That's the one on the left with the green handle. So double-ended, it has small and medium tips. This is unique instrument to LM, and what is unique is the particular design of the very tip. So at the very bottom, at the very end, the tip is completely flat. The unique part is how the tip flares up towards that very tip. So the diameter of the tip is the very largest at the very bottom of it, and it gets smaller right as you come onto the shank from the tip. That is a very nice detail when you are packing composite on a cavity that you have prepped. That flared tip shape allows that entire bottom, the working end of the tip, always get right up against the inside enamel margin when you packing the composite. Most instruments are either straight or tapered, and it may be difficult to get it all the way up against the inside margin when packing. On the right hand side, the orange handle. So this is basically a ball burnisher. As overall design, this is a little bit carryover from the old amalgam dentistry, but the reason it was brought over, many practitioner feels that this small ball shape is very good and well suited to create specifically the occlusal surface when building a tooth using resin material. This too is double-ended. One end has 1.5 millimeter in diameter ball, so very small, and the opposite end has 2.5 millimeter ball. So I would say about medium size ball there. Now, these next two are the Modeller MH. This is a unique instrument style to LM. This was created by a professor at Helsinki University in Finland, I believe. What is unique about this instrument is if you look at these tips, it has overall a cylinder shape. However, the very tip, the most active part of the working end, is completely rounded, so it looks like a half ball. And it boils down to physics. So the creator of this instrument figured that when you use a flat tip instrument to build composite, step by step in layers, when you have a flat surface, the surface area is only so large. The easiest way to increase the surface area is create this kind of cupped bowl or concave bottom shape to it. That alone significantly increased the surface area, and assuming everything else is done properly, the larger surface area will result into a stronger adhesion and potentially also a stronger restoration. Here we have two sizes. On the left-hand side, greenish handle is the regular size, and this combines medium and a large tip on the one instrument. On the right-hand side, in a purple handle color, is the Mini, MH Mini. This combines small and medium tips on the one handle. And when I look at from the sales side, the situation, the purple one, small, medium combo, has become a little bit more popular between these two packing instruments. The next two on the left-hand side, red handle, LM calls it the Packer Modeller IO. It certainly can be used for packing and all kinds of modeling. This is more of I'd say a duck head, or let's say rounded off cone shape instrument. Has small and medium tips, and the tips really, they are fine-tuned and shaped enough that they are quite nice and accurate to shape the occlusals when building a tooth, but they are round enough that they're not potentially gouging or creating too sharp areas when building the uncured composite. A very good instrument. Combined with the spatula, a lot can be done in the mouth for any basic restoration. On the right-hand side, this is our first combo instrument in the presentation. So this is a very small, I would call this a mini. We call it the plastic instrument interior, but I think mini is equally descriptive, if not more. So on the one tip, there is a small straight paddle, and on the other side is a small condenser packer. Certainly can be used anywhere with any patient. Many practitioners find this useful with pediatric patients for the size of these tips. Now, the last two in our dark diamond line are these two. They also have become quite popular amongst the practitioner. On the left-hand side, yellow handle. This is our standard size, kind of universal combo instrument. This too has a straight paddle on the one end and then a condenser plugger on the other instrument. This really is, the lack of a better term, a workhorse of an instrument. You can do a lot of carrying, shaping, and also condensing, packing. And the way the condenser packer is designed, you can also do a little bit of occlusal shaping with that instrument. So very universal combo instrument. Last but not least, orange handle LM mini spatula. Why it's called mini, I'm not entirely sure. What that truly is, it is a universal spatula. The tips are common, medium, regular in size. One tip is a straight paddle coming straight from the shank. The opposite tip is an offset, forming a hoe type of a design and angle there. All of the dark diamonds are rigid, so they don't have bend or flex to them. They can be used for any and all types of restorations. They really seem to shine when more sticky resin materials are used. Also fantastic for everyday fillings. Now let's move on to other selected instruments. And while we still are on the composite, wanted to highlight here on the left-hand side is the LM mini spatula, which I think is a universal spatula in our conventional Duracrate Max steel. And why we're showing this is just a reminder that many of these dark diamond patterns are also available in our conventional Duracrate Max, including this universal spatula. This would be an excellent choice in situation when maybe you feel that you don't have any issue with stickiness, so you don't necessarily need dark diamond coated instruments. Or maybe the situation is such that a slightly lower price point, yet for the highest quality instrument, would be desired. And there probably are practitioners out there who prefer a different handle style that we have offered in the past, and these conventional instruments may be purchased in some markets in these other handle options. Now, the next instrument here is a cord packer. If you don't have one yet, if you are not using one, I highly recommend just get at least one and try it. The thought process here is if you need to pound a nail on your wall, can you pick up a rock and use it? Maybe. Would a right size of a hammer be better tool to pound that nail on your wall? Probably so. Same thing with the cord packer. I have met many practitioners who use whatever they have to pack their dental cord. Some use spatulas, some even diagnostic instruments. Sometimes it works, sometimes not so well, but with the appropriate tool, it would certainly work better and it would save you time. Also, that word pleasant we mentioned earlier might surface when you are pleasantly packing the cord without problems. So we have two models here. They look about the same. The difference is how wide from side to side on a working end they are. One is the 2.0, so it has a 2mm wide tip, and the other option is the 2.6mm wide. 2.0, I've noticed, has become more popular. So this is truly universal, double-ended. The tips are rotated so that with this one instrument, you can get on every surface on the mouth to pack cord. And there is zero pullback of the cord. I know many practitioners who have sometime in the past tried a cord packer with the serration, so these little teeth at the end of the working end. It's a great instrument to get the cord in the right place, but when you pull the instrument out comes the cord. Very frustrating. This is not the case with the LM cord packer. Number two, the thickness, you don't really see it in this picture, but the thickness of that tip is right about perfect. It is just wide enough that it securely sits on the cord as you're tucking it in, but it is slim enough that if and when you are going between the tooth and the tissue, it nicely slides in. So definitely helpful instrument for preparation for restorations. Now, more of preparation instruments here. So we're moving into excavators. So spoon excavators, I also call these long blade or long nose excavators. These are very good instrument when you want a longer working end, a longer blade, especially if there's a little bit larger or a longer surface you're wanting to hit at one time. Here we have two options. We've got the 1mm and a 1.5mm instruments. And the measurement refers how wide is the actual working end, how wide is the tip measured from one cutting edge to the other cutting edge. So as you can see, these are double-sided instrument. Each tip is sharpened from both sides, and also the rounded toe is sharp, but the measurement tells you how wide from cutting edge to cutting edge that tip is. Here, with the spoon excavators and all other excavators, the LM handle, that medical grade silicone, that grip, that leverage you get from it is very helpful when you are prepping the tooth from that carious dentin. These instruments also in some markets are available in different handle options, even they here are only shown in the ErgoSense. Then we've got the round excavators. So here, as the name implies, the working end is completely round, so it looks like a disc. Of course, the same intended use, removal of carious dentin. And here the entire tip all the way around is also sharp and a working end. We offer 1mm, 1.5, and then 2mm options. And this again tells you how wide is the working end, the disc measured from side to side. I don't know if you have tried other excavators, but one nice thing about, of course, we talk about the handle already, that makes a huge difference when you really want to have a good grip. But the way we make these instruments at LMDental in Finland, we do a beautiful inside clean out on the face of this instrument. So it makes these very sharp, and the evenness of the sharpness all the way around that edge, around that disc, is just very good. Last but not least, on the excavators, we've got the back actions. So these are the round excavators. So they also have the same disc shape working end. But the difference here is the back action, kind of like the name would imply, they were designed to reach a little bit further, and especially be able to reach a little bit more difficult to reach surfaces, like for example distal surfaces, whether distal on a tooth or distal in a cavity prep. Difference here compared to the regular round excavator that we saw here is that the disc is actually leaned in, so it's pulled back towards that lower shank, kind of bending in from there. It's about, give or take, 30 degrees angle. So that facilitates that reaching and getting on those, for example, distal surfaces. Here we offer 4 different sizes. 1 millimeter is the smallest one, then 1.5, 2, and then quite large, 3.5 mil is the biggest one. And these two are offered in some markets, different handle options. Last but definitely not least instrument in our brief restorative presentation today is the LM Minicycle. And again, we noticed that we have lots of minis here. Again, I would call this instrument a universal scaler. And why this is part of the rest though, this is absolutely fantastic instrument to be used as a excess removal, any overhangs, and also even to, let's say, finish off an interproximal when doing a composite restoration. So this is an instrument from our periodontal and a hygiene line. So it's a universal scaler. It is well adapted on the whole mouth, interior, posterior, double-sided. Each tip is sharpened from both sides, and the very toe is sharp. So it beautifully gets in the proximals. The blade is small, yet it's strong enough to get the job done. That was briefly it. I would like to say kiitos. This is thank you in Finnish.